A next barrier to adequate nutrition can be dementia. Can be said more generally as just cognitive disorders. So there can be, when we have any sort of impairment in memory and judgment, it can make things like, first of all, shopping and food preparation much harder. It can also make things like even remembering that it's time to eat, or did you have a meal already today, can make adequate nutrition very difficult. For example, my grandmother had dementia, and um, we made the same amount of food for her because at this time it wasn't safe for her to use a stove, so we brought microwavable meals or cold meals for her. And as her dementia progressed, there was more and more food being left behind, and it was because she was forgetting to eat or that she hadn't eaten yet. So she needed more reminders. So we want to try to help the patient be as independent as possible. So could a friend take them shopping, for example? Um, could we, also monitor for deficiencies through lab monitoring? Is there a Meals on Wheels, for example, or a family friend who can make meals? Um, Also, setting up a schedule can really help with dementia, like having meals at the same time every day in the same location. Keeping environmental distractions to the minimum will increase overall food intake. There is a risk for impaired swallowing and chewing, so we want to make sure the food is cut up into small bites if it is more moderate to severe dementia. Alteration in senses. This can be vision, smell, or taste. So things, for example, if you have poor vision, it can make things like shopping difficult. Food preparation can be difficult. Safety, not burning yourself on the stove. Uh, Smell is a great sense that we can actually use. It can actually it can help with increasing appetite. So if you're having a patient who has difficulties with that, things like we used to do in the assisted living I worked at is like make bread in the afternoon. So the smell of the bread the residents would be in the dementia unit would become it would kind of be a cue to them that it would be time to eat. It would also increase their appetite. Now you can see, however, now if your patient has a decreased sense of smell, all foods are going to taste the same. Especially smoking is a big one that impairs sense of smell. So we want to try to encourage that patient to quit smoking. Also, there is certain medical treatments that can change, like for example, chemo can change the taste of food and make things taste metallic, or it can mask the taste of the food. Then there is impaired swallowing, which we have talked about significantly before. So I'm not going to really talk about that too much other than remind you about the appropriateness of the diet. Do they need their liquids thickened? Do they need to be on a mechanical soft or pureed diet? We want to teach them about how to do things like chin tucking, as well as, alternating solids and liquids as a way to help improve swallowing. Then we can have a patient who has mechanical fixation of the jaw, also known as having the jaw wired shut. This happens after some sort of the jaw is fractured. And so now it can be immobilized for several weeks, and they're going to be put on a liquid diet. So we want to make sure they know how to use the straw properly, how to put it between their wires so they're not moving those around inappropriately. And then lastly, knowledge deficit or lack of knowledge or misinformation can abound. So we want to make sure that all of our clients have a basic understanding about nutrition. We want to correct anything that's misleading or confusing, especially things like come out like fad diets. I can tell you a thing right now, for example, that we've talked about is gluten-free, or this diet is very popular right now. It's thought of as being a weight loss, and that is, a misinformation. You do not want to eliminate gluten from your diet unless you actually have celiac disease. So instead, things we're going to do is we're going to encourage our patients to use things like the My Plate, maybe even use the Super Tracker. We want to make sure that we're doing an assessment of their intake, like doing a 24-hour recall, making sure they understand how to read a food label by doing things like the Teach Back method. Another very important thing to do is talk about is portion size, and making sure what food choices they're choosing are healthy. Is the patient, for example, or the client eating most meals out, fast food? That is something that we'd want to do some more in-depth assessment to see, is it a knowledge deficit, or is it, a convenience? Where does the person's priorities lie? Those are the most common barriers to adequate nutrition.